The grieving process is a very subjective experience. It differs dramatically from person to person, and is often mitigated by factors such as your age, your gender, your cultural background, your past personal experiences, whether you have a history of mental health issues or trauma. So it differs dramatically based on all of those factors. The expression of grief, likewise, can also differ quite a bit from person to person. So when we talk about grief and loss, we often think about strong emotions. So we think about things like anger, fear, sadness, despair. But some people experience physical symptoms, so they can feel nauseous, they have headaches, aches and pains, and they experience these physical symptoms as a response to their grief. Some people experience cognitive changes, so they talk about feeling confused and disoriented, having memory difficulties, not being able to concentrate as well as they could before the loss. And some people talk about social changes, so withdrawing from others like family and friends. So the expression of grief is multifaceted. It can have social changes, you can have cognitive changes, physical changes, spiritual changes. So it's not just limited to emotions. Also, when we think about grief and loss, we think about the death of a loved one often. But grief can be related to any type of loss. So it can be related to the loss of your mobility, your functionality, your identity. It can be related to the loss of a job, a relationship, whether that's a friendship or a romantic relationship. So why you grieve can also differ tremendously. It's really important to take care of yourself. So you need to eat right, sleep if you can, exercise if you can, and it's really important to keep connected, especially to your family and friends. It's also equally important to talk about your loss and not keep it with you. So to talk about what's happened, to express your feelings in a tangible way. If you don't feel comfortable talking, some people like to write things down, some people like to express themselves through art, so painting or drawing. So whatever it is, it's important to have those feelings come out. And if you do need help, it's really important to see your GP, and they can link you up with a psychologist or psychiatrist if needed. Please do seek help and do take care of yourself if you're grieving, and especially if you've just experienced a loss.